Welcome to episode 2 of Rise, Recover, Repeat by Rise Physio Plus. Our mission here is to keep you moving well for the long term. And today we're super lucky to be joined by Cassandra Haber, who is our clinical manager at Sliema. She has a great background in physiotherapy, is very passionate in physiotherapy. In her free time, she also loves aerial silks. She's physically active and she really embodies all the values of Rise. And today we'll be talking a little bit about the care of older adults, and that can be quite a vast topic, and how physiotherapy has a lot to do with that. Should we be physically active or should we be passive? Is anything different when it comes to the care of older adults? So for that and more, join us in this episode coming right up. Hey everyone, I'm Matthew Camilleri, the founder of Rise Physiotherapy. Welcome to episode 1. The Rise, Recover, Repeat series is all about building a healthier and stronger you. We'll do our best to bring interesting content, speak with professionals in the industry. If you've left a course of physiotherapy treatment and all you've attained is not feeling pain, the probability is that problem may and probably will come back. One of the big things that we're always looking for is to give substitutions of movements.
Instead of saying just do a squat, we try different things. Can you sit down on the chair?
So first session is where we can exercise without fear.
Our first huge value is... So Cass, can you tell us a little bit about you, what your background is with Rise, what your interests are, and kind of what brings you here? How did you end up here?
So I've been a physiotherapist for the last 12 years, and the last 4 we've been working together at Rise. We started at the Imperial in Sliema, so yes, definitely we have background in older care, rehab. What I'm passionate about, definitely I can say physiotherapy in general. But I did my master's in London. I have my master's in biomechanics, so movement analysis, going both into looking movement analysis for sports and exercise, but also when we're looking at pathology, so clinical populations. And that is where I continued to grow and gain my experience in.
Okay, and you also, which was really interesting, you had spent a season working in a ski resort, so what was that like? So that was quite a cool experience as well.
Definitely more on the sportsy end. One of my passions is snowboarding, so I decided to go and work as a physiotherapist, what we call a ski physio in Val d'Isère. So basically treating injuries that happen on the snow slopes or on ice, walking on the road, basically.
Okay, and lots of time snowboarding then as well,
exactly.
So that's fantastic.
Because the injuries tend to happen during the day and I would work in the afternoon.
Okay. And you're also into aerial silks. We tried a class together lately, which didn't end very well for me because I ended up smashing my face. I did try my best.
Well.
It's much more challenging than you would think. It's quite a lot
of... It
of...
looks soft.
I walked in thinking it's going to be the easiest thing in the world, and then I was quickly humbled.
All those rugby strengths didn't translate so well.
Fantastic.
My background as a child was always gymnastics, dance, then went into aerial acrobatics and aerial fitness, and my favorite equipment is the silk, so the silk ropes, and I've been doing that for a good 4 years now.
Wow, okay, fantastic. So shall we dive into a little bit on today's topic, which is the care of older adults? So can I maybe it's a bit of a challenging question to start with, but what would you consider an older adult? This is such a bone of contention because there isn't really like in the books, it's not like, okay, you've hit this age and now you're older, or you're no longer to do this or no longer to do that. So what do you think about that? So what is an older adult? What is, like, how do you view someone who's, maybe we need to act a little bit different, or do we even need to act differently?
Well, I'm definitely not going to give you an age where we can start calling people old, but yes, I think it's always a question every year we grow older. But going back to the point, I guess we can start looking at treatment of the older adult when we start looking at not just injuries, but also other pathologies. So having people who have, I don't know, back pain, but they have a history of, arthritis, possibly osteoarthritis coming over time, looking at someone who has decreased mobility because there was a history of a stroke 5 years ago, rather than we're looking at the neuro rehab of stroke rehabilitation in the acute stage. So basically, I would answer that with looking at people who have a history, a medical history, apart from the current injury
you're dealing with. Okay. And do you feel there's more complexity, I guess, when it comes to dealing with an older adult? There's perhaps a lot more you need to think about, and there's a lot more going on, and it's not just because everyone has a psychological input and there's always a little bit of history there, maybe some anxiety, some worry about the problem, but there's multiple like medical comorbidities, which are other things going on apart from the problem you're dealing with. Yeah, and it kind of leads me to my next question, which is, do you feel that the care of someone with these complexities, who perhaps biologically is a little bit older, do you think that the care needs to change? So in your experience working with people who are perhaps a little bit older with comorbidities, how do you deal with them or that population group differently than you would with someone perhaps younger, who's athletic, what's the difference there?
So definitely the approach has to adapt. You also have to look at the client holistically. Not everyone has the history of being into exercise and sport. So yes, even if the evidence-based research is showing that exercise is the way to go, if you have someone who never did exercise in their life, your approach has to be more gradual, getting the person on board with the rehab program and adapting it to make sure that it is achievable, because at the end of the day, you have to work as a team with your client, with your patient, to get the best health gains possible out of your physiotherapy program. In terms of adaptation, yes, we have to look at the comorbidities, what they are. So let's say we're looking at someone with, trying to think over the top of my head, let's say someone going back into neuro, someone with a history of a stroke, someone with a disability, or
something like arthritis, which you mentioned earlier. So that's something we see very common. So degenerative joint changes.
Exactly. So if there is a movement that is painful, or the patient or the client has fear in going in for that movement, you work around it. So definitely you can adapt the exercise program, your approach to suit the client in front of you best.
And I think you're talking a lot about these soft skills a lot, which we value a lot at Rise. So where there's this adaptation to the person in front of you, and even the way you speak, the message you're giving, the education you're giving is a little bit different. Do you feel that is a big thing in your treatment, both of the older adult and even a younger person, just this self-management, this education component, and how do you bring it into your sessions?
Yes. So we always go from an evidence-based approach. What does the research show us is the best way to treat the person? But then you have to look at the person in front of you, and you try and make those two pictures meet and merge in the middle. I feel that the best way to get your client on board with applying the right rehab program is to educate. So yes, in the first session it will involve a discussion of what the plan forward is, rather than having a template program that everyone has to do the same thing. If someone with knee arthritis who went knee replacement surgery, you have person A and person B, that doesn't mean that the first session is going to be the same for both.
Of course.
Doesn't mean that the 10th session will be the same for both. So you sit down in the first session, you see what I discuss with my client, what are their aims, what do they want from physiotherapy, and what do they expect. And then you say your part. So then I say my part, what I expect, what I want to get out of our work together. And we make sure that our goals are aligned. And like that, I do find that with my clients, then we end up achieving those goals better, because there was this initial discussion.
Yeah. And I think that initial discussion just pushes so much towards this thing that we talk about a lot, which is therapeutic alliance, that the physiotherapist and the client are one team together. If you're always fighting and at heads with each other and not matching your wants and their wants, it just becomes such a negative thing. And I really feel that what you spoke about now, about talking about expectations, is something I do with my population and my cohort so much nowadays. Because what I think they want to achieve and what they want to achieve might be two completely different things. I mean, it might be as simple as, I want to be able to pick up my grandkids at Christmas time, you know, and we've had cases like this before. So I really do commend you on mentioning this, on matching expectations and having this initial discussion with patients. So one thing I'm really interested in maybe an older population or someone with a lot of comorbidities, is how do you match, because you spoke about something very interesting before, which is you suddenly have someone in front of you who's never exercised before. They're in pain and we're asking them to exercise. And that's just such a complex or tough psychological thing to adapt to. So how do you manage to get that out of the person? If your expectations is you want to get them moving more, how do you input maybe strength and conditioning or rehabilitation or movement into a program with someone who's so hesitant about moving because of pain?
Of course. And adding on to that question, a lot of that hesitation comes from misconceptions. People would have been told, oh, you shouldn't bend because that is wrong for your back. You shouldn't twist, or you shouldn't squat because of knee arthritis, or you shouldn't, I don't know,
bend forward because of your back.
Exactly. You shouldn't walk long distances. And and sometimes these people would have been hearing these, let's say, misconceptions repetitively, and they start believing them, and then they come to you and you're the one telling them, oh no, that is all wrong. But you try not to say that's all wrong, but you try and indicate that you can work around it, right? That exercise is not all bad, movement is not all bad. Actually, most movement is going to be beneficial. Anyway,
so how do you, so what I was going to ask,
yes,
or what I was trying to, like, how do you get people to start to move? Like, where do you introduce movement? Like, how do you regress something enough to not make it challenging or scary for the person?
Most of the time, let's say we have a back pain situation, I would start working in the clinic, especially someone who's very hesitant and scared of movement and exercise. I would avoid going in the gym on the first day, so keep it a bit more of a closed, controlled environment, and going with simple movements. Going with, whether it's exercise on the bed, exercises sitting down, exercises they can do easily at home with things you would have at home without needing any special equipment. If they're not comfortable going on the ground, then we won't go on the ground. So first session is about finding those boundaries of confidence, of comfort, where we can exercise without fear. And then every session I try and go and
push
nudge that boundary.
Always stealing that little bit off.
Exactly. Always with a smile. And usually, once you have a good result with one session, then you're going to gain confidence from your client, and they're going to be good with you pushing the boundary a little bit further.
Trust.
Exactly, and with every session you build more trust, you're working together, you're getting great results, so those boundaries keep getting pushed
wider and wider,
away.
and all of a sudden they're at the Olympics.
I mean, we haven't reached that far yet, but who knows? But yes, then I try and move away from physiotherapy long term. I try and go into more integrating exercise into a daily routine.
Of course.
Whether it's going for a walk, going for a swim, whether it's joining a Pilates class, whether it's doing personal training, whatever floats the person's boat.
Yeah, and I think it's just so interesting that you mentioned that, because without any prompting, without me bringing it up, you've talked about one of our long-term values, which is being the long-term solution specialists. And what you said is just, it's so vital. You can't tell someone what to do long-term, because if they don't enjoy it, they're never going to get there, you know? So I think that's just so interesting that you embody that, you believe it, and it's just so much part of your culture and who you are as a physio. So that's fantastic. And it really leads me to another question, what I was going to ask you, and I think you might have answered it already, is what's the best way, I hate saying the best way because there's no best way, but to prevent falls in older adults, to prevent things like fractures, which as we know are unfortunately one of the biggest things that threaten someone's lifespan, because they do actually put people in hospital beds and people tend to not recover. So is there a best way? Is there like something you recommend to multiple people on how to avoid ending up in that situation? What's the prevention? Because we love it more than the cure.
Yes. Well, in terms of prevention of falls, you can work on strength, but you have to also have balance and coordination work as part of your exercise routine. Whether you're doing exercises at home, whether you're doing a Pilates or yoga class, there has to be a balance and coordination element, because if you're not training that part of the brain that helps control your balance and coordination, then it's not going to improve. In fact, with aging, as we all know, everything starts to decline. Muscle mass decreases, bone density decreases, and same with balance. So it is something that we have to involve in our exercise routine, basically. In terms of preventing falls, it's about remaining active, making sure there is that element of exercise and fitness in your weekly routine. The more immobile you are, if you're going to stay, let's say,
stuck on a sofa or in bed
down
or
at home watching TV, and then the few times you're going to stand up and walk, those times are not going to be enough to stimulate the maintenance of your muscle structure, of your balance structures in the brain functioning well. So you're going to get faster deterioration, and the risk of falls is going to be higher. I mean, then there's also an element of adapting your surroundings to decrease the risk of falls.
So you mean things like carpets on the floor, loose furniture, pets?
Enough lighting, not having things in the way. If there is the need of a walking aid, going for it. Adapting your surroundings to make it easier to move around, basically.
Yeah, I think you've covered that quite extensively.
And you mentioned fractures as well. So with regards to fractures, especially in women post-menopause, bone density decreases, as we know, and the risk then of fracture, getting a fracture, if
increases.
There's a fall, increases. And research shows that weight training then has a very good effect on preventing that bone loss, and then that because of that, then you're preventing the risk of fractures if you do fall, if you do have a
something
tumble.
happens. So a lot of people are afraid of lifting weights when their bone density drops. So is it your opinion that they should be lifting weights? So if bone density is low and someone maybe has a little bit of aches and pains, which does come with post-menopause, do you recommend weightlifting and strength training at that point?
Definitely. I mean, I'm not saying we have to start Olympic weightlifting and doing clean and jerks, but we will definitely need to load. And ideally, there is supervision, especially if we're loading, going heavier. So we're not talking about 1-2 kilos here. We do need to
progressively increase the load.
Challenge the load, and to have the confidence and to also prevent risk of injury. Ideally, there is supervision, whether it's with a coach, whether it's with a physiotherapist. So the program is gradually increasing, and the client is going to be confident to continue with that gradual increase in a safe environment.
Of course. And once again, coming back to the point you mentioned before, it needs to be an environment where the person is comfortable as well. There's a lack of fear, a coach that they trust, and that again boosts this adherence concept and this long-term management solution which we spoke about before.
Exactly.
Perfect. One of the things we've spoken in depth about is this difference between lifespan, which is how long, like biologically, we're alive, but then this super important concept of health span. So how many years we're healthy for, we can do our activities of daily living, do sports, do things that we enjoy. So I guess it also links into this, like how do we promote that health span from early, so from when you're in your 20s and 30s, but then as an older adult as well. So how do we stretch these years when we're healthy? What would be your top tips or advice?
Well, you have to start applying these from as early on as
course.
possible. So basically, eat well, hydrate, recover well, sleep, and exercise.
Totally.
Those are the main points. You can't do anything more than that.
Yeah.
You have to take care of your physical body, you have to take care of your psychological health as well, and maintain that throughout the years. So yes.
Yeah, and like everything else, I guess it's not about doing these complex things. It's not, I mean, these little add-ons are all nice, but in reality, it's the little simple things done consistently, which make all the difference. So I think like most other things in life, that's the direction we're always preaching and telling people.
Consistency is key.
Consistency is key.
Yes.
Okay, Cass, so a little tradition we have here is we have 3 top questions to ask you, okay? So these will just be like nice, short little questions which we're just looking for a couple of answers for. So Cass, one thing I'm really interested about, what is one myth about aging or exercise that you wish to kind of debunk or cut out forever? So one thing that people are constantly saying to you in your clinical practice and in your mind you're just going, shut up.
About aging.
Or exercise.
Or exercise. Yes, I think the one about bending my back is going to give me a slip to this.
Yes, that's a big one. Okay, so you'd love to stop hearing people that bending forward is going to cause a slip disc and ruin their back. Okay, top question number 2. How much does your job involve being a cheerleader versus a physiotherapist or a coach? Like, do you feel like you're constantly having to push people, like always being this little cheerleader, jolly, and does that have an effect on you?
Interesting question. I think I would say 65% cheerleader and then 35% physiotherapy.
Yeah. Well.
I mean, you have to promote. Otherwise, you can be the best physiotherapist, but if you have zero motivation in your clients, then it's all going down the drain, no?
Yeah. And it helps that you're such a positive person as well. You're always giving out to all of us at Rise and to the clients, so fantastic. So, last one, is there one thing you wish everyone knew about aging, about staying active? So what would be your secret advice to a member of your family? So one secret bit of advice that you'd give everyone about aging?
Well, it's not a big secret, but I would say you're gonna age anyway, so get on with it and exercise.
Make it graceful. Fantastic.
Exactly.
Thank you, Cass, for coming on. I hope you enjoyed it, didn't find it too stressful, and you managed to maintain your positivity through the rest of the day.
Thank you for having me. No, I enjoyed this.
Fantastic.
I didn't know what to expect, but I really enjoyed this.
We really do throw people into the deep end. So I hope you all enjoyed that episode. If you did enjoy it, please let us know. Please subscribe on all the channels where we'll be sharing this. And of course, if you have any questions about active aging, if you have any questions about being more active throughout the lifespan or anything you'd like to ask Cassandra, please drop it in the comment section below and we'll be more than happy to answer, and we'll more than likely have Cass on again talking about another topic. Thank you so much for your interest.